Okay, so let's look at the last part of the topic. So I'm going to call it part 3. Okay, so let's look at management. Now, like I mentioned yesterday, Ben's patients are trauma patients. Okay, Ben's patients are trauma patients. Okay, in other words, apply the what? The ATLS protocol. Okay, so specifically the ABCs, right? The ABCs. Okay, so make sure that you apply that. Then, other than that, obviously, what you need to do is to stop the burning process. Okay, so you can also look at the first aid. What do you do? So, one, you have to stop the burning process. Okay, that is if you are there when the burning process is occurring. Then, number two, you can also cool. Okay, let me just accept someone that has joined. Okay, the other thing that you can also do is to cool the area that is affected using water, right? Use water. Obviously, you don't have to use, here you are doing what is called continuous irrigation. Okay, continuous irrigation with clean water. Okay, now let's look at indications. Indications for admission, right? Indications for admission. Now, what are the indications for admission? So we have moderate, okay, or severe burns. Okay, when someone has moderate or severe burns, here you have to admit. Okay, then burns in special areas, including airways, including the airways. All right. So someone with such kind of burns, you have to admit. Okay. Then extremes of age. Extremes of what? Age. So too young and too old. Okay, if the patient is too young, children and adults, okay, extremes of age, those that are too young and too old, you have to make sure that you admit. And then lastly, or electrical, which is falling under severe burns anyway, electrical or chemical burns. Okay, electrical and chemical burns. So when you find these, make sure that you admit the patient. Okay. So now, let's look at the other thing that you have to do. Okay, on the definitive treatment. So let's look at treatment. How do you treat patients with burns? Okay. So number one, all right. So like I mentioned earlier, you have to maintain the ABCs. Okay. The number two, you have to give analgesia. Okay, analgesia. So in other words, you give painkillers because the patients are going to be in pain. And what type of analgesia and how much will depend also on the degree and the age of the patient. Okay, then obviously you have to go ahead and assess things like the percentage, the degree, and the type of pain that is involved. Then number three, the other thing that you have to do is you give what is called chemoprophylaxis. Okay, so chemoprophylaxis here, basically you want to give tetanus toxoid antibiotics. Okay, tetanus toxoid, antibiotics. Okay, tetanus toxoid, antibiotics. Okay, and what? Other than that, you also give local antiseptics, right? Local antiseptics. So this tetanus toxoid antibiotics is basically trying to prevent tetanus, right? And then local antiseptics, they're just trying to make sure that the wound is kept clean. Okay, the wound should be clean. Now, sometimes, other than that, let's look at fluid resuscitation, and this is very, very, very important. Okay, let's look at fluid resuscitation. So you have to give fluids in this patient because remember, we're saying that they are losing fluids. Okay, remember the skin barrier has been disturbed, so fluids are coming out. So remember all those blisters and so on, the inflammation. So these patients are losing fluids. So you have to give them fluids, right? And other than that, because of the stress, there is increased what? Perspiration. And through perspiration as well, someone is losing what? Fluids. Okay. So you have to give fluids. Now, fluids are given in two ways. Okay. So there is one what is called replacement or deficit. Okay. And then two, we also have what is called maintenance. Now, I want you to pay particular attention on this. This is probably the most important of this topic. Okay, we have replacement and what, and maintenance. Now, what does it mean when we say replacement? To replace simply means to put back what has been lost. Okay, maintenance, it simply means you make sure that what is there remains there, isn't it? I think literally that's what it means. Replacement, you put back what has been lost, and then maintenance, you make sure that what is there remains there. Okay, now uh, with replacement, okay, we use what is called the Parkland's formula. There are different formulas that are used. Okay, by the way, what I should mention is that in the first 24 hours, ideally, in a normal setup, in the first 24 hours, you have to give crystalloids. Okay, the type of fluids that you give crystalloids. Usually, we give Ringer's lactate. Okay, then after that, that's when you can start giving what colloids. Okay, and also other blood and blood products. Okay, if you want to do blood transfusion, whatever, that you can only do that after 24 hours. Okay, so now let's talk about this replacement. So here we use what is called the Parkland's formula. Okay, Parkland's formula. Of course, like I've mentioned, there are other formulas that are used, but most commonly we use Parkland's formula to calculate how much fluid to give. Okay, now Parkland's formula here, we say it is what? 4 mils, okay? 4 mils multiplied by body weight, okay? Then multiplied by total body surface area, okay? Body surface area in terms of percentage, right? That's how you calculate the replacement fluids. Okay, so let me give an example. For example, if the patient is in, let's say the patient is 45. Okay, let's say 45 kgs. All right, and then the body surface area that has been affected is in, let's say 26%. Okay, 26%. So how much replacement fluids do we give? What is the deficit? Okay, so this is simply going to be equal to 4 by 45. by 26. Okay, 4 by 45 by 26. So if we calculate that, let me just get my calculator. If we calculate that, what are we going to get? Okay, so that is going to be 4 by 45 by 26. So that is 4,000. Okay, 4,000. Have I done the correct calculation? 4 by 45 and then by 26. Okay, 4,608 meals. Okay, in 24 hours. All right. Now, one thing that I should make clear is that some of our lecturers would tell us that patients do not read books. Okay, patients don't read books. So, what is in theory and what is in practice sometimes may differ. So it depends. So in as much as we are saying that we have to give 4,680 mils of these fluids, which literally almost 5 liters of fluids. Okay, so you have to be careful not to overload the patient. Okay, you may end up overloading the patient, so you have to be very careful. Okay, especially in children, we tend to, instead of using 4, we can go for 3 here. Okay, we can use 3 there. So sometimes we say it's in 3 to 4. All right, mils by body weight and then by body surface area percentage. So that's what we can. Then in children we use 3, in adults we use 4. But sometimes in other setups we use the same number, which is 4. However, the caution here, the caution is that make sure that you don't overload the patient. Okay, so you have to be on the lookout for any features of fluid overload. Right now, once you've calculated that this is the amount of fluid that you have to give, okay, the first you have to divide this into two. Okay, so this is what you have is 4,680. So you divide that by 2. Half of this is in 2,340 mils. Okay, just like you divide it into 2. So 2,340 and another 2,340 mils. Okay, so the first half you have to give in 8 hours, and then the other half you give in the other 16 hours. 8 plus 16, that is 24. Now, this means that the first half you give in 8 hours from the time of injury. From the time of injury. Remember, when we're talking about taking history, when we said when you're taking history, you have to take note of the time at which the injury occurred. So let's say, for example, this is, let's say 12, this is 12 what? The time is 12, 12, right? So let's say this injury occurred at, let's say at 10 hours. Okay, so let's say it occurred at 10 hours. It means that from 10 hours up to now, you've had approximately 2 hours that has already elapsed. So this 2 hours is going to count to the what? To the 8 hours. Okay, so you have to add 4 more hours. So what is remaining is, 6 more hours. What is remaining to make 8 hours is 6 hours. So you have to add the remainder time. So there is the time that has already passed from the time of injury up to the current time. So the time that has passed in this case is what? 2 hours, right? So how much more time is remaining to make the first the 8 hours, the first 8 hours? It's 6 hours. So you add 6 hours to this, okay, it's going to give you something like 18 hours. Okay, approximately 18 hours. So in other words, you need to give these 2 liters of fluids from now up to 18 hours. You have to run those fluids from now up to what? Up to 18 hours. Okay, I'll go through that again. You give the first half of the fluids in 8 hours. Okay, you give the first half of the fluids in 8 hours from the time of injury. You also take account of the time that has already passed. So in this case, I've given an example. This is a patient who's 45 kgs with 26% burns, okay, and then presents, the burns occurred at 10 hours and presents at 12 hours. So the time that has already elapsed, maybe from the time it occurred, they were trying to travel to come to the health center, maybe they went to the clinic, from there they were referred to your hospital and so on. And hence there's that time lapse, okay? So there is already that 2 hours that has elapsed, and it is counting to the 8 hours. So when they come, after the 2 hours has already gone, how much more time is remaining to make the 8 hours? It's 6 hours. So they come at 12 hours. So at 12 hours, you have to add how much more time? You have to add 6 hours to make 8 hours total. Okay, so it means that from 12 hours up to 18 hours, you have to run what? About 2 liters of these fluids. Okay, you have to run about 2 liters of the fluid, which is your what? Your deficit. Then the other half, you have to give it in the remainder 16 hours. Okay, so in other words, you have to, if this is today, okay, the injury occurs today at 10 hours, you have to run the fluids, this replacement, you have to run it up to tomorrow approximately at the same time, which is 10 hours. So from 10 hours today up to tomorrow 10 hours, that is 24 hours. So the first 8 hours, okay, from 10 hours to 18 hours. So this patient presents at 12 hours, right? Presents at 12 hours, okay? So from 12 hours up to 18 hours, you have to give the first half. And then from 18 hours up to 10 hours the following day, you have to give the other half. Okay, I hope that is clear. Like I mentioned, you have to make sure that you do not overload your patient. Don't overload the patient, please. Okay, don't overload the patient. Right, now, so that is about replacement. Then we look at what is called maintenance. Okay, we look at what is called maintenance. So with maintenance, we use what is called Holly-DeSega method, or rather formula. Okay, Holly-DeSega formula. Okay, now what is this Holly-DeSega formula? So this is 100, okay, 100 by 50 by 20. Okay, so this is mils. Okay, this is if you're calculating in 24 hours. Okay, then we can also use you can have this is 2 by 1 by 2 by 1, okay, in 1 hour. Okay, I hope I'm not mistaken, right? So okay, let me just cross check that. Okay, yeah, perfect. So now what does it mean? So we have 100 by 50 by 20 if you're calculating that in 24 hours, right? And then you can also have 4 by 2 by 1 if you're calculating, if you want to calculate how much fluids to give in 24 hours, you use that. Then if you want to calculate how much fluid to give in only 1 hour, you use this. Now what does it mean? Okay, what does it mean? What it means is this. Okay, what it means is that the first 10 kgs of the patient's weight. Okay, let's take the first one. If we are calculating fluids for 24 hours, the first 10 kgs you multiply by what? 100. Okay, so in our example, the patient is in 45 kgs, right? So the first 10 kgs, we're going to say this is 10 kg by 100 mils per kg. Okay, this is going to give us what? 1000. Okay, 1000 mils per 24 hours, right? Okay, so this is going to give us what? 100 mils per 24 hours. Okay, then the second 10 kg you multiply by 50 mils, okay, per kg per 24 hours, right? So the first 10 kg you multiply by 100, the second 10 kg multiplied by what? 50. So in this case, this is going to give us what? 500 mils, okay, per 24 hours. Okay. Then the last, for each last kg, okay, multiply by 20, okay, multiply by 20 mils per kg per 24 hours. So in this case, we've already taken away the 10 for the first one and another 10, so we've remained with what? 25 kgs, right? So in this case, we're going to say 25 kgs, okay, multiplied by 20 mils per kg per 24 hours, okay? So this is going to give us what? This is going to give us 450, is it? Okay, so 20 by 25, that is 500. Okay, so this is going to give us 500 meals per 24 hours. Okay, so if we are to add the total maintenance then is going to be equal to the first 10 kg, which we had what? We had, let me try to use different colors. Okay, so we had the first 10 here, which was 1000 meals per 24 hours. Okay, then we also had the second there, which was 500 meals. All right, 500 meals per 24 hours. And then the last one that we have is 500 meals per 24 hours. Okay, so it means that the total maintenance fluid that you're going to give is what? Is going to be 2000 meals per 24 hours. Okay, which is approximately 2 liters of fluid. Okay, which is about 2 liters of fluid. So now, what does it mean? What it means is that the total amount of fluids that you're going to give this patient, okay, now I'll still give that caution. The total amount of fluids that you're going to give this patient is going to be, remember, our deficit was in 4,680 mils in 24 hours. Then maintenance is what? 2000 mils in 24 hours. Okay, so the total amount of fluids that you're going to give is going to be 6,680 mils in 24 hours. Okay, so for this patient who's 45 kgs, okay, and with 26% bends, you are going to give 6,680 mils of fluids in 24 hours. Now, I'll still say that make sure that you don't overload the patient. Okay, make sure you don't overload the patient, because this 6,680 mils of fluid in 24 hours is just way too much. Okay, so always make sure that you counter check. Okay, counter-check if the patient is developing any signs and symptoms of fluid overload. Okay, so that is how you calculate the fluid. Now, this maintenance, okay, the maintenance fluid, you start giving it, it starts counting at the time of presentation, okay, or at the time when you give, just when you give the replacement. So let's say the patient comes at 12 hours, okay, let's say the patient comes at 12 hours, and then for you to do everything, let's say you start giving the fluids at, let's say 12:10. Okay, let's say at 12:10. So it means that you're going to run the maintenance, you're going to add it together with that, you're going to run the maintenance up to the following day, 12:10. Okay, up to the following day at 12:10. Then after that, all you're going to be giving is just the maintenance fluid. Replacement is only given in the first 24 hours. And then maintenance from the time of presentation up to the time when the patient is probably discharged. Okay, so that is how you calculate fluids, or rather fluid therapy. That's how you go about it. Okay, so please take note of anything to do with fluid overload. Okay, in as much as you want to help the patient, you feel the patient is losing a lot of fluids, and then you end up giving more fluids than necessary, and that is going to kill the patient even faster than the burns themselves. Okay, so please take note of that. Now, what else about management? So we've talked about fluid resuscitation. Okay, so by the way, when you talk about maintenance fluids, you're going to find that in any other case other than just these burns. Okay, you're going to find that in any other case. All right, so let's look at local management. So other than fluids, what do you do to the wounds themselves? Okay, so local management. We should be concluding any soon. So with local management, we have what is called number one, the open method. Okay. Now with open method, what you do is that there's application of what is called silver sulfadiazine. Okay, without any dressings. So you apply silver sulfadiazine. Okay. Here you don't put no dressings at all. You leave it open, and that's why it is called the open method. Okay. Now this is commonly used in especially in the face and the neck. So if the burns are involving the face and the neck, usually you give what? You give you do not use, I mean, you do not put any dressings. Okay. Then we can also have what is called the closed method. Okay, so the closed method, here basically what you're doing is just the same, but here you put, so there is a silver sulfadiazine. Okay, and then here you put dressing. Okay, you have to put the dressing. Then you can also do skin graft, specifically what is called tangential. Okay, tangential skin grafting. Okay, so you can do skin graft within, in this case, within, it has to be within 48 hours, okay, from the time of burns, and if the burns are less than 25%. So if the burns are less than 25%, within 48 hours, you have to do the skin graft. Okay. Then so there are other ways of covering these burns. Okay, for example, you can you can also do the other methods of skin grafting, right? Okay. Now let's look at complications. Let's look at complications of burns. Okay. Now, complications of burns, we can have them as immediate, okay, immediate, early, okay, and late. Okay, immediate complications, early complications, and the what? The late complications. Okay. Now, the immediate complications that you can have, okay, you can have things like wound infection. Okay, wound infection. Those are going to be immediate. Okay. Then you can also have septicemia because of the same infection, right? And then you can also have anemia. And that's why sometimes you can also give blood. Okay. So other than anemia, you can also have these stress ulcers. So remember I talked about the Killings ulcers. Okay. Then other than that, you can also have paralytic ileus. Okay. So remember in the pathophysiology, we talked about reduced motility or absent motility. Okay. So we can have paralytic ileus. Then you can also have you can have what? You can have also compartment syndrome. Okay, compartment syndrome. I should have given you this as your assignment anyway. Okay, and then you can also have renal failure and so on. Okay, renal failure. Now, why are you going to have renal failure? Okay, so in this case, because of breakdown of muscle, okay, you're going to find that the myoglobin is going to get deposited into the what? Into the nephrons, okay, and then because of that, it's going to cause renal failure. Okay, then you can also have poor wound healing. Okay, poor wound healing. All right. And then you can also have things like amputation. Okay, then let's look at the early. I should have talked about the early complications before talking about the immediate, because the early complications are coming earlier than the immediate. Okay, so I'm going to have hypothermia. Hypothermia, remember the skin is not there, so there's loss of temperature. Okay, hypothermia, can also have hypoglycemia. Remember, there is increased metabolism, isn't it? Okay, there's increased metabolism, so because of that, a lot of glucose is being used up. And then you can also have hypovolemia. Hypovolemia, I think I talked about this in the pathophysiology. Hence, you're going to have low cardiac output. Then, other than that, you're also going to have hypoxia. Why is the hypoxia? Remember, we talked about in the respiratory system. Okay, there's going to be respiratory insufficiency. Okay, you can also end up with airway obstruction. Airway obstruction. Other than that, you can also have actually it's not hypoglycemia, it's hyperglycemia. Sorry. Okay, then you can also end up with shock. So if this hypovolemia is not treated, you can end up with what? With shock. Okay. Then let's look at the late complications. The late complications, what you're going to have, you can have contractures. I think I mentioned that, contractures. Okay, you can also end up with things such as keloids or hypertrophic. So on Saturday, someone should present on keloids and hypertrophic scars. Okay, hypertrophic scars. So I'm going to have a presentation, but let me check who's here so that we give someone in advance, someone to present on keloids and hypertrophic scars. So who's the lucky one? Who's the lucky one? Who's the lucky one? Givens Chisala. You're the lucky one. Who's Givens Chisala? You're going to present on keloids and hypertrophic scars on Saturday. All right. So tomorrow someone is presenting on prostate cancer. The other day someone is presenting on what was that? Forgotten the topic that I gave. Then on Saturday you're going to present on. I may not be there. I'm going to see if we can set a time when I can be free. Okay, so that I should be there, right? So you're going to present on hypertrophic scars and keloids. All right. Then you can also have what are called Majoline's contractures. Okay, contractures. Now these are malignant. Okay, these are malignant. Then other than that, you can also have nerve compression. Okay, you can have nerve compression and so on. Okay. Then of course, the other thing, the other complication that you can have actually is psychosocial. Okay, psychosocial complications. Why do I say psychosocial complications? Imagine someone ends up with all these scars because of the burns. They end up with scars, the hypertrophic scars, the keloids, whatever, or the contractures. They are going to be, they start feeling like if, for cosmetic, okay, cosmetic. Especially, this is more common in females, right? This is more common in females. So people tend to develop these psychological problems. Okay, so this is about the topic burns. Okay, this is about the topic burns. I think I'm going to end there. We've talked about a lot of things. It's quite a long topic. Okay, so we end there for today. If there are any questions, you can ask, but I'm going to end the video here.